Ads that often mean you're dealing with a true medical emergency, where every single second counts. Getting these right can literally be the difference between a good and a bad outcome.
First on our list is Beck's Triad, and this one points straight to cardiac tamponade. Just picture this. The heart is literally being squeezed by a sac filled with fluid. Now, this pressure causes a few key things to happen. One, the heart can't pump effectively, so blood pressure plummets. That's your hypotension. Two, because blood can't get into the heart easily, it backs up into the neck veins, causing them to bulge out. That's your jugular venous distension. And three, when you listen with a stethoscope, the heart sounds are all faint and muffled, kind of like you're hearing them through water.
Now, you really want to burn this into your brain. This is a massive clinical pearl. If you walk in and see a patient in shock, hypotensive, and you see that raised JVP, your brain has to immediately think cardiac tamponade. You have to assume it's tamponade until you can prove it's not. That is a critical takeaway for any emergency.
Okay, now and talk about Charcot's triad for acute cholangitis. So this is a really serious infection of the bile ducts. When those ducts get blocked and infected, you get this classic trio of symptoms. High fever, as the body's fighting that infection. Jaundice, because the bile is backing up and turning the skin yellow. And this really intense pain in the upper right part of the belly.
But what happens when that infection gets even worse, when it really spirals out of control? Well, that's when we get Reynolds pentad. You have the first three from Charcot's triad, but now you add two really scary signs. Shock, meaning the whole circulatory system is failing, and altered mental status or confusion. This isn't just a simple progression, it's a 5-alarm fire. Reynolds pentad is a true medical emergency that needs immediate intervention.
All right,